What's up, rookies? Welcome to another episode of the Rookie Pharmacist podcast, where we showcase what pharmacists do and explore inspiring pharmacy career paths. Today, I'm so excited to have with me fellow Touro University, California School of Pharmacy alumna, Dr. Fatima Hernandez. Fatima's career spans from public health, inpatient pharmacy, community advocacy, and I'm so excited to have you here to share your journey and the several roles that you've played throughout the years as a pharmacist. Welcome, Fatima. How have you been?
I have been doing great, and thank you so much for having me. I've
I'm
been
so
looking,
excited to have you.
and
So excited
I
to have
was
you.
looking forward to talk with you and chat for a little bit about what pharmacists do.
Yeah, and you and I have kind of not known each other like directly, but we heard of each other and like seen each other's stories, pieces by pieces here and there on social media and through Turo. So I'm so excited to finally have this connection with you today.
Me too. Thank you for having me.
Oh,
Appreciate it.
I'm so glad you're here. Okay, so let's start from the beginning of your journey. What inspired you to choose pharmacy as a career? Was there a particular moment or experience that solidified your passion for pharmacy?
So I know I'm gonna sound like such a cliche, but I'm actually a third generation pharmacist. I follow into the footsteps of my grandfather, my father, and my older brother. And while we all share this noble profession, I'm actually the only one who holds a doctorate in the field.
Oh, okay, I had no idea. Third generation, you said?
Yes,
Amazing.
my
Okay.
grandfather was, I grew up in a small town in Nicaragua, and my grandfather was the owner of the first pharmacy that was ever, built in the
In the
small town.
Nice. See,
Yeah.
fun facts, fun facts. I had no idea, and I'm sure a lot of people didn't know that.
No, yeah, not that many people.
Yeah, so we have a family history of pharmacy. It's like an
Yeah.
HP, family history of being a pharmacist. And then any other particular experience besides following in family footsteps?
See, so actually, yeah, when I was 8 years old, I witnessed my dad to help a kid to get better. I didn't know what the kid had.
Mm-hmm.
The lady was actually given no hope from the local clinic when we're living in Nicaragua. I was just, I think, 8 years old, 7 years old. She was waiting for my dad at 6:30 because people from the market had told her that to go talk to my dad, maybe, with his expertise, medicine and everything, and the pharmacotherapy, he might be able to help her. So I always say that I witnessed a miracle because the kid actually got better, got well. My dad actually had a background in medicine also.
Mm-hmm.
In our countries, they just don't, pharmacies are not just, selling medications. It's more like a clinical pharmacies where
Oh,
you have to have a medical
cool.
background as well,
Cool.
diagnose and treat. So,
Okay, okay.
that's the reason why he was actually very um,
Good.
knowledgeable on the
Mm-hmm.
topic.
Mm-hmm. Mm-hmm. Mm-hmm.
and
Mm-hmm.
and like I was actually unaware of at the time that I actually what I saw him doing was actually a profound impact at what pharmacies can have acting as a healer, actually as a beacon of hope.
Oh, wow.
And
Yeah.
but I was forbidden from studying pharmacy when I was growing up.
What?
um I
Why?
know. Yeah, so it's not on the business that runs in the family. My dad's, he only had one pharmacy, so he was concerned that I was going to compete against my brother. So he said, "You cannot be a pharmacist, so you could do anything else that you want, except a pharmacist."
Oh,
So
wow. Mm-mm.
when I started growing up, the only careers that he said he was going to support was either being a doctor or a lawyer, and I'm like, okay, I'm gonna start studying medicine then.
Okay, okay.
And I went on that path for a while. I actually graduated as a general doctor outside US. And and
Wow.
yeah, but I didn't want to study a specialty because I was like the first opportunity I have, I'm gonna jump back to medicine. And
Mm-hmm.
that's why I'm gonna jump from medicine back to pharmacy. I don't know how, but it's gonna happen.
Uh-huh.
That's when I actually started working as a pharmacy tech in what now disappeared that it was Kmart. I
Mm-hmm.
started as a pharmacy tech in there, and little by little, I got like involved and found my passion again. And I was like, "This is me. This is what I am. I was born to do." And that's when I got accepted into Touro, and I started studying pharmacy.
Hmm. What a story. It's always fascinating for me to hear like what drives someone to pursue pharmacy, but I never heard someone said the family was against it. So you kind of witness a miracle from a pharmacist at a young age, and then that sparks the passion. And
Yes,
then with your background in medicine already and landing that job at Kmart as a pharmacy technician, it kind of goes from there and you go to Touro University, same school that I went to.
yes.
Okay. So your career is kind of a remarkable blend of impactful roles from like vaccine equity officer to your current position as an inpatient pharmacist. Can you walk us through how your career evolved? What moments or decision led you to take these diverse opportunities?
So I actually chose a non-traditional path in pharmacy.
Yeah.
Um, I initially wanted to be a community pharmacist, inspired by my, by the impactful work that my father did.
Mm-hmm.
But
Mm-hmm.
however, life just led me a different direction when I moved back to Texas to care for my mother. During my time there, when I graduated from Touro in 2020, I came back to Texas and I contracted COVID here.
Yeah.
After my recovery, I felt
We'll talk
compelled
more
to make a
about
move.
that later. Yeah.
Yes, yes.
Yeah. So
Yeah,
you
so
graduated right in the midst of COVID. You're the COVID
yes,
class of
yes.
2020. Yes,
So
yes. So,
with the COVID experience that I had in Texas, I wanted to make a difference as an immunizing pharmacist, and that's when I signed up
mm,
to go be a
mm,
pharmacist in the rural areas of Texas. And
mm.
each day, up to 200 people like line up outside the pharmacy for a vaccine, which
Wow,
is just a testament of the community's need at the moment.
absolutely. Yeah,
And
yeah.
like it didn't matter a snowstorm. One time a snowstorm actually caused a power outage. And in that moment of crisis, I contacted one of our professors, Dr. Chan.
Dr.
And
Lucinda Chan, yes.
yes,
Our
and
mama,
yeah, our
our
mama.
mom, our tour mom. Yes.
And I was just like, hey, I just need some reassurance. Am I interpreting this right? Because we had about 1,000 vaccines in the store, and the store manager was actually relieved because he couldn't contact the vaccine team for the company I was working for,
Mm-hmm.
and they fear that we're gonna lose 1,000 vaccines, or we needed to find 1,000 people to vaccinate that day. Because I used my resources, I was able to save that for more people to get vaccinated the following days.
Yes,
So
yes.
that actually that's when Turo was looking for someone to lead the vaccine efforts with the grants they received from Kaiser.
Yeah, I remember.
So they always said to me that I was handpicked, but I'm not sure. But
I
I wanted,
mean, why not with all that personal experience and then
yeah.
the work you were already doing back in El Paso?
But
Hello.
like how sometimes you feel that you're not doing much and it's just your job, and I always say that it's a gift that I was given, and I'm just like for furthering that gift and sharing it with the rest.
You're just
And
being humble.
yeah, I guess so.
Yeah, because it was truly impactful. And then Turo saw that, and then
Yes.
they invite you to work with their own immunization program.
Yes.
Mm-hmm,
Yeah,
mm-hmm.
and that's when I moved back to California and I started
Okay.
leading the Touro CARES MVP project.
Right, right, right.
And
Mm-hmm.
it's like this journey was actually a journey of resilience, service, and actually prepared me to take on the role of the vaccine coordinator for the university. And
Mm-hmm.
then they actually this one it was the one that reinforced the impact that we can have when we raise the challenges, because then I didn't even realize that I was started to be called the vaccine equity officer, and it was because the university got very close to the county. And that's the title
Mhm.
that I was given by Solano County when we started working close with them. And they okay, we
Vaccine
have.
equity officer. See, it's truly a non-traditional path.
Yes,
This is
exactly.
the pharmacist, but you're a public health officer leading this vaccine program for a whole county in the midst of a pandemic. That's huge.
Yes, and it was big because if it wasn't for the support that everyone at Turo gave me, and
Hmm.
also the trust, because like I felt like I was just recently
Graduated.
graduated.
Yeah,
And
yeah,
I'm like,
yeah.
you giving me this responsibility to be the face in the middle
Hmm.
of a
Hmm.
pandemic,
Hmm.
and
Down
and
to yeah.
yeah, in the county, and show others why it's important to get immunized, why educating them, educating our students to become trusted messengers, and help us kind of share the information with the community, and work with other public health
Hmm. Hmm.
uh,
Hmm.
officers to kind of propagate the information and what everything that we could do. Even in that case, with Turo, we graduated from Turo, but also represent them in these non-traditional ways
Hmm. Hmm.
outside, or just being pharmacists. And one of the weirdest things that I always say to people is like, it's like, yeah, I was a pharmacist, but I was just wearing jeans and t-shirts during that role, because it was the only way to connect with the community.
Yes,
Many
I get
felt
it.
that having a white coat, it was putting kind of a wall, a
A
barrier between.
barrier. Hmm. Hmm.
And having us just have like casual clothes help a lot. And that's actually one of the most amazing adventures that I could say that I had.
Wow.
Fortunately, when the grants ended this year, that's when I'm like, so what am I gonna do now? I've
Oh
only been doing this
no. That's
for
the thing with grants. They end and then you rely
years.
on them being renewed. So it didn't get
Like,
renewed.
it was renewed three times for 3 years. Kaiser Partnership Helpline California,
Mm-hmm.
and
Mm-hmm.
then the county actually renewed the last grant that we had to
I
finish
see.
immunizing. And we actually grew as the program because it was actually went beyond just the COVID vaccines. We started doing influenza vaccines with the county,
Mm-hmm.
and eventually it led to the Tdap vaccine because there were many kids in the Solano County that were not, uh, up to date with the Tdap
Got
vaccine,
you.
so they
Mm-hmm.
were being excluded. So we also help the county with that immunization efforts.
Mm-hmm. Mm-hmm. Mm-hmm.
Yeah.
This is like this is a true testament to the fact that you've embraced a dynamic career with
Yes.
a dynamic career path. And each role from being a student to patient to the vaccine coordinator with the MVP tour program has brought something unique to your journey.
Yes.
Yeah. And now you're working, so you're back in El Paso, you're back in Texas
Yes.
now, working as an inpatient pharmacist.
Yeah,
Can you
and this.
share that? Like, what are your primary responsibilities in this role, and how does this position challenge you and fulfill you compared to your previous work in public health and vaccine advocacy?
One thing I think I actually kind of went over one step. The pharmacy director at the medical institution where I now work, he actually studied in California, so he was actually familiar with with the clinical curriculum we have in California.
Mm-hmm.
No, and he was actually, I don't, he saw in me something. He says, I think you're very clinical and I want to take my chance. I don't have a residency. I didn't have the opportunity to go and do one. So,
Mm-hmm.
but my background in the clinical pharmacy that I have my education
Mm-hmm.
was
Mm-hmm.
able to get me that job.
Oh,
And,
your medicine education.
yeah,
Got you,
so,
got you. And even the work you did in the community,
yes.
that was all. I mean, a lot
uh,
of it had to be clinical. It's
yeah, and my,
all
my
hands-on public health.
And my best recommendation letter was actually from a public health official from Solano County. So it wasn't
Wow.
from,
See how it
yeah,
all ties together?
yeah. So
Wow.
it's just funny because that was I said that when I got interviewed for the job, they said that it was very non-traditional having someone outside the pharmacy world vouching for me. So I'm like, oh my God, oh, okay, I didn't know.
That's true though. Like that speaks for itself. That speaks to the degree of your networking and involvement outside of pharmacy, which makes you a well-rounded person.
Yeah, and like in inpatient pharmacy, I have responsibilities like also like you do. I do medication verifications. I have I had to assess drug interactions. I
Mm-hmm.
collaborate with providers to identify alternative therapies
Mm-hmm.
based on the hospital formulary.
Right,
And then
right.
also I go from medical surgery floor and the NICU. And also
Hmm.
with the NICU, I had to ensure the well-being of our tiniest patients by verifying the fluid orders and preparing custom TPN.
Oh, yes.
And that was
Yeah.
the first time that I heard the term vanilla TPN. Believe it or not, I didn't know what it was until I started being an inpatient
I
pharmacy.
believe you because we must have had like one or two lectures on TPN in pharmacy
Yes.
school.
Yeah, and that's the first time I'm like, oh, I had to do a vanilla TPN. And I was like, when they gave me the weight of a baby, like 0.6 kilograms. I'm like, what? This is not an adult.
That's a
So
pretty.
it's a yeah, premature baby. So that's one of the things that I take my time a lot
Were you
when
nervous? Were you nervous doing all these new tasks?
yes, I was really like, okay, how am I gonna do this? How am I gonna come up with the right numbers? But
Mhm.
being a pharmacist and being up for challenges, I actually started studying again,
Yeah, yeah.
reviewing everything that I
That's
did
one
not
thing we're really good at. Studying and reviewing and looking up what we need to look
looking
up
up
and figuring out the answers. Yes.
exactly. And
Yeah. Yeah.
it was a challenge the first day, and then it went easier by the days go by, and
Yeah.
I
Yeah.
was able to do it faster and faster. And of course, doing Banco calculations, that's what we
Yeah.
do
Yeah. Yeah.
a
Yeah.
lot.
And I
And
like how you say it's not easy in the beginning, but the more you do it, the more comfortable you get.
yes,
And
and
then, but you still learn every day though. Like you never
yes,
get too comfortable, right?
yes, and that's the thing right now. When I'm like the main pharmacist for the day, it's not only medical surgery, it's also we have to look at the ICU orders. And one of the daunting things that I always said was ICU drips and management of critical care patient management. And that's when I was like, well, I didn't sign up for this. I was supposed just to be patient. I didn't think I had to be doing with ICU patient, CCU patients, or NICU
Yeah.
patients.
Yeah. But
But
then things happen. They
it
need
does
you
happen.
places, and then you have to fill in. Yeah.
Exactly. And just by not saying no, just like, okay,
Oh my God.
it's hard, but let's push yourself. Let's put together like a working plan and just find the ways how to overcome challenges and learn as fast as you can, because you already graduated and
Yeah.
you don't
Yeah.
have 30 minutes anymore. You only have like
You're big girl pharmacist now.
exactly.
I like how you mentioned not saying no, but that's a great advice to give to be open to opportunities and possibilities and just see where they lead you. Right.
Yes.
Okay. Okay. So we went over your responsibilities in the inpatient pharmacy setting, which pretty much include managing medications in various units, surgery, NICU, ICU, collaborating with healthcare teams, and ensuring optimal healthcare outcomes for patients, right? Okay. COVID and personal impact. Your personal experience with COVID is both. I remember seeing, and it was so you made some amazing posts of you in the hospital, intubated, scary. I read your story and it was very moving, but also inspiring. Can you share how that unfolded and how it influenced your approach to pharmacy and obviously your role in leading the Touro CARES MVP program?
Yeah, so actually, that very personal experience deepened my empathy for the frustration and the
Mm-hmm.
misinformation that many people encounter at the
Mm-hmm.
beginning of the pandemic. When I faced significant challenges myself, even as a pharmacist, being diagnosed with COVID and admitted in a hospital, my journey through the healthcare system was very tough. And and then that critical moment, I was told that I was gonna probably lose conscience, and they asked me like to find advocates. And I actually was fortunate to have to choose two of my former professors as my health advocates, because my family, they were not familiar with the healthcare system at all. I
Mm-hmm.
was actually their translator, and they're like connecting
Mm-hmm.
bridge
Mm-hmm.
between them and the medical system.
Mm-hmm.
And so, I was fortunate to have Dr. Durugar and Dr. Chan. They became my health advocates. And I remember writing my wishes on a napkin and taking a picture and sending it to them. And it's like, this is my wish.
Okay, let's
And
pause for a second. Dr. Durugar and Dr. Chan are Touro University faculty. Okay.
yes,
And this here, your Touro University people become kind of like your
power of attorneys.
power of attorney.
Yes,
They're here in California, you're over there,
yes.
Texas. And on a piece of paper,
A napkin.
napkin, not even a piece of paper, you put your life or that situation into these two wonderful women whom
Yeah.
I am also lucky to know. And they say yes, they're going to take on that responsibility.
Yeah. And they felt like they were like my my own mother, and because like I said, the healthcare system in El Paso was collapsed when I got sick. And
Hmm.
I was actually discriminated because since I was Hispanic, first thing that they told me, what COVID party did you go to? And I said, what do you
Wait,
mean? I'm a pharmacist. Nobody believed me I was a pharmacist to start with. And I got sick not because I went to a party. I said I got sick because I was renewing my CPR license, my BLS, to get a job. And they said, no, you're not a pharmacist. I said, yes, I am a pharmacist. And
wait,
nobody
is
believed
this
me.
members of the healthcare team
Yes.
actively, repeatedly denying the fact that you're a pharmacist?
I know. And they believed me actually when they saw my health advocates. And that's when, unfortunately, if it wasn't because of having good advocates, I would say I wouldn't be here,
Oh my
because they actually kept calling and calling and calling. Like you say, Dr. Chan, I remember she telling me like, I even have to tell them that if they wouldn't tell me how you were doing, I was gonna fly on a plane and go into the hospital, and I didn't care you were in a close facility, and I want to walk in
God.
there, and I'm
Actually.
gonna see you, and I'm gonna make sure you're okay. And I'm like,
Oh
are you sure? So that these are the stories that she was telling me after I got better.
my God.
But I'm like, I believe that because things change, and not only for me, but for all the patients that were in the work. Is I felt alone. I was scared. I was so alone. I didn't see the nurse for like only couple, maybe 1 minute at a time, every maybe 3 times a day.
Oh my God.
And so like it wasn't just me being feeling neglected, it was the rest of the people. And then not because they didn't want to take care. I understood that everyone has they were scared, scarce resources and all that, but
Yeah.
I didn't think it was that the reason why they were not looking after me. And being a pharmacist actually took it as had it advantage, because I remember one of the nurses left the first remdesivir dose that I was supposed to get on top of the table. She left it there. She never came back until the night. And I don't know, maybe my craziness and delusional brain
The
I started
pharmacist
screaming.
in you?
The pharmacist in me said, "No, you cannot administer that on me," because it
Like,
has
how long
been
has it been out to room temperature? What is the stability of this remdesivir right now?
exactly. So those things were the things that actually kept me, I would say sane
Alive.
and alive because I kept telling them, "You cannot do this. You need to make it again." And then I will call Dr. Uber. They want to administer remdesivir. I don't know how long it's been there, and they want to give it to me, and I don't want to be an experiment because
Oh,
it was between
yeah.
being sick, trying to keep myself alive, and also my pharmacist brain kicked in at the time. So,
That's so funny. Funny now, not funny
yes,
back then when it was happening. But okay, okay. You get better.
yes.
You get better. And I still go back to how truly inspiring it is that you turned such a challenging personal experience into a
Yeah.
mission to serve others. Thank you for sharing your amazing story with COVID and how you turned your test into a testimony for Solano County and Touro and pharmacists in general. Your career blends inpatient pharmacy with public health. How do these two roles intersect for you? Would you say that pharmacists are, in fact, public health professionals?
So, my current job does not focus heavily on public health advocacy as before, but I still advocate for patients, medications access. I always try to help them find affordable options and connect them with resources for benefits that they deserve.
Mhm.
And actually, because it seems like public health is my call, I still have a side work.
You
Actually,
have a side job.
yes, a side job. I'm teaching the medical Spanish for Turo, and also I'm teaching the community health workers. Now I did it in Spanish, in English, and now I'm gonna have the course in Spanish about vaccine education and resources. And it's outpacing education access and the effective interview techniques just to kind of replicate trusted messenger in the community to help bridge the gap of healthcare access and
Yes.
vaccines and education, because at the end of the day kids need to be vaccinated to have access to education if they want to go to school. So that's one of the things that I keep promoting. I think that's probably I'm gonna end up in one of those roles. I'm not sure yet, but it's one of the things that I do. Actually transformed the curriculum for the medical Spanish that is given through the College of Medicine and College of Pharmacy,
Mhm.
and I included a cultural humility module. And it's just to prepare future healthcare professionals to connect meaningfully with patients, not only with a "Hola, ¿cómo está?" but also knowing their feeding habits and the difference. And something as a different that comes with the curriculum is like it became from you need to take one metformin twice a day to tell a patient you need to take metformin with your biggest meals. And the students are like, why are you saying that, Dr. Hernandez? I said, because Hispanics do not eat a big breakfast. And if you tell a Hispanic to take metformin with breakfast, that's actually just set them up for failure.
Mm.
They will not adhere to it because of the side effects. And
Yes,
they didn't
yes,
understand.
yes.
And I said things like that, now they're being taught in the
Yeah.
course too. And that's one of the things that I continue doing the advocacy as a pharmacist.
You're so amazing. You're doing all this other stuff on top
Yeah.
of your full-time job. Okay, so what I'm getting is skills like patient communication, cultural competence, and clinical expertise transfer between areas. They're
Yes.
interconnected, which can come in handy when you work with public health initiatives and vice versa in the inpatient pharmacy or with even in ambulatory care pharmacy. You brought up the example of consulting a patient on diet and meal.
Yes.
Yeah, culturally, in a cultural sensitive way, in a way that's going to have impact. That's such a unique perspective, and it's amazing how different areas of pharmacy can complement and strengthen each other, right?
Yes. And you know, one of the things that the students were not aware, that usually happens a lot in the on the labels, on the medication labels, is when we put take this medication once a day for 90 days. I started telling my students from the medical Spanish class,
Hmm.
if you put that on a label of a Spanish speaker patient, they're gonna think that they're only gonna take that medication for 90 days, no less and no more. And I
So after
said that
90 days, they're gonna stop.
stop, yes, because
I
that's
never
what the
thought
label
about
says.
that.
I know, and you know, and that happens. I see it every day with my family. I see it every day with my mom. I don't need to take this med because it said 90 days. And I'm like, oh my God, here I am. Here we go again. The
Oh, the
pharmacy.
doctor was just trying to give you a 3 month supply. That's all.
And that's what I keep telling the pharmacy students I have in the class. I
Hmm.
said that is for the pharmacy, and I also educate the medical students saying that note is for the pharmacy. Just put it as a note, because unfortunately, the Hispanic patient is very abiding of everything the doctor says, and
Yeah,
if you
yeah.
put 90 days, it's 90 days. And
Oh
now that they actually are in rotations, they
yeah. Uh-huh.
notice that, oh my God, Dr. Hernandez, I didn't believe you that the 90 days was true. And then they tell me, yeah, that is true. Like people say that, no, I don't need that Mac because it said 90 days.
I like how you said no less, no more. They're gonna
Yeah,
follow it to the T, and then what happens if you have diabetes and you're taking metformin? That's for definitely
exactly.
longer than 90 days. Or
Yeah.
insulin or your blood pressure medication. So
So,
small details that
exactly. Even the cultural aspect of pharmacy is very important for patient treatment adherence. And that's one of the things that I focus on the class. One of the hours I just devoted to prescription labels and like how to advise your patients, your Hispanic Latino community, that it's not only 90 days, how to tell them side effects. So it's not only like I said, it goes beyond connecting with your patient, just like hola, me llamo
yeah, yeah,
Fatima,
yeah, yeah.
but also understand where they're coming from and why they're not following
Oh yeah.
directions. And unfortunately, sometimes it's us to blame, and it's supposed to be things simple as that, and that it does create impact on the
Abs-
medication adherence for patients.
Absolutely. Thank you for bringing those up. Very important. Very important. And that's going to change my own practice. That's a light bulb going off definitely.
Yes,
And I'm sure
exactly.
this is just one example.
Oh yes, we could
We
actually
can go
talk
on. We can have a whole other podcast on what not to tell Hispanic patients or specific
exactly.
cultures about their medication. So just give them what they need to know.
Yes, and
Mhm.
I see that sometimes doctors do not put what the medication is for, and many of the patients that now come to the pharmacy, to the inpatient pharmacy in the hospital, and they bring their medications from home, they
Yeah.
actually arrive for why they're taking that med. So then I realized, what, we actually kind of lacking this. Why don't we put what the medication is for? Some people do, some
Hmm.
others don't, but I do see it in Spanish. And then they ask me, hey, what are they writing here? Oh, that's the indication. So the
Yeah.
patient put,
Yeah.
oh, para la diabetes.
Yeah. Yeah.
So,
Yeah. Yeah.
and I said, and that's why putting why they're taking the medication is very important, because they want to know why they take the tablet
Got you.
every day.
Got you. Got you. You faced some significant challenges in your career. Maybe one of the big ones we've mentioned, which was surviving COVID. But I want to ask you again a general question about what are some of the biggest challenges you've encountered and how you have navigated them, because everyone's going to go through challenges, and it's how you get through them. I think that's very important.
Yeah, so I always say that in my career, besides surviving COVID, I had two biggest challenges, and they both dealt with the educational part. One of them and biggest challenge, in my opinion, is actually training the vaccine ambassadors. These vaccine ambassadors from the Touro CARES MVP, 33 amazing students, to make them very trusted messengers
Mm-hmm.
within our communities. And they came from different backgrounds. It wasn't only pharmacy students. And in my case, I had to do it with determination, and I needed to admit also that I needed to look for assistance from other healthcare professionals in order for me to help enhance the knowledge that these students provided,
Mm-hmm.
for growth and learning from their mistakes, and giving the students multiple opportunities to grow and to learn from mistakes was one of the biggest things, because we always are expecting some sort of a perfection when you're doing these jobs, and knowing that you're just building, shaping their minds, and these people, they don't have your own background. They wouldn't understand why pharmacists do things the way that we do it, the
Yeah.
same way that I didn't understand why a nursing student was doing the things the way they were supposed to do it, or a
Mm-hmm.
medical student.
Mm-hmm. Mm-hmm.
So the other challenge at the same moment was be part of an interprofessional team, and how to keep everyone aligned and focus on, or share a mission. So I actually needed to go back and study again to
Again.
connect, yeah, to connect effectively with how to connect effectively with medical, with nursing, with PA students, not only pharmacy. So we can actually embrace the unique approaches of each of these fields, and and learn from everyone regardless of the position or experience level. The same way that I've learned from students, that's one of the things that it was the biggest challenge, to say, what, I don't know where you're coming from, but I want to learn, and I want to incorporate it into my practice in order for me to grow and to understand every aspect of the healthcare system, and to see how it could function better for the patients, not only for us as healthcare workers, but also for the patient, how to use these different fields and make them align perfectly
Yeah. With the
to take
mission.
care of the patients.
Yeah.
Yes,
The
just to
ultimate
take care of
goal.
patients.
Yeah.
Yes.
Yeah. So you said you have to go back and study. I'm curious, what do you study to learn this skill and teach it?
So I actually had to do a lot of clinical skills, pathophysiology to connect with the
Medical
how good with medical students, why, how to answer the questions, and
services.
then kind of go to workflow, how a nurse, why the nurse say to you no when you're a pharmacist, like you could do it this way, and they say no,
Yeah.
it
Yeah.
cannot be done that way.
Okay.
So I needed to learn their workflow. I needed to learn pathophys and more in depth, and I
Mm-hmm.
needed to learn, like I said, the other side of the coin, because like here are pharmacies, but then I felt there were like so disconnected pieces, and how to put them together in order for us to serve one purpose. Because like the vaccine, the Touro CARES MVP,
Yeah.
it was multidisciplinary,
Mm-hmm.
so it needed to function in a way that where we all could learn, we all could grow, we all could serve the
Absolutely.
community.
Absolutely.
So that
Yeah.
was actually thing. I did remember that I did a lot of clinical. I would say, okay, let's go do our clinical rounds in clinics, and everyone was like afraid. It's like, why would you do clinical rounds with, uh, pharmacy, PA, medical, and nursing students? How
That's how
can you
it's
do
gonna
that?
be in the real world.
Exactly. And
Yeah.
I said, it's easy. Doing clinical skills does not mean that I know more than them. It means that I'm going to contribute with
Yes.
what I know in my field.
Expertise. Mm-hmm.
Yes, exactly. And then I will let the student, do the part that it was for them, their
Yeah.
contribution. And then we actually, in the clinic, actually went more than vaccines. People will come with diabetes, and they would ask us about side effects, if the medication was giving them side effects.
Yeah. Yeah. Yeah.
And then, like the medical students would go and like interview the patient. So they would do patient
Like history.
doctor skills, history,
Mm-hmm.
yeah,
Mm-hmm. Mm-hmm.
H&P.
Mm-hmm.
And
Yeah.
then the pharmacy students would do the med interactions and taking the medrec, and then the
Medrec,
nursing students would do the all the the clinical skills that they
assessment.
know,
Yeah,
the
yeah,
vital signs and all
yeah.
that. And then we will come up with, okay, is this what is causing the patient these? And then they would say, but can we give the patient an answer? I said, only under my pharmacy license, this is what we could say to the patient.
Yeah,
So
yeah,
it was more just than vaccines.
yeah,
We also try to impact the communities in those other
yeah,
ways as well.
yeah. Okay, first thing, one thing I just remember is that we didn't spell out MVP. What did MVP stand for?
Oh, the Touro CARES MVP. So it's the CARES is for child and adult resources,
Mhm.
education and support, vaccine, mobile vaccine program.
Mobile vaccine program. Yes,
Yeah.
yes. And then you, if I understand correctly, your challenge was working interprofessionally with different healthcare providers who have their own different backgrounds, and figuring out a way to collaborate and work together to help the patient. So,
Yes.
besides challenges like addressing health disparities, building trust with the underserved populations, managing acute cases in the inpatient settings, I think this is the ultimate challenge that pharmacists are going to face is working in an interprofessional team and understanding the importance and their place in that team and knowing that it's possible. And in the real world, I was shocked as a new practitioner to see that when the doctor would call me or a provider would call me and say, what dose should I start for this patient? And I would recommend a dose. And 2 minutes later, I would see that ordered on the patient's chart. And I'll be like, oh my God, he actually did what I told him to do. The doctor actually takes our advice very
Yes.
seriously. And then these ends up in the patient's order and it ends up in the patient's mouth and the patient's system.
It's amazing
And it's
how.
amazing. And it's important to know for pharmacists to know that this interprofessional team thing is real. And we need to learn to work with it and grow within it, and make it a success like you did with this Touro Cares MVP program. Awesome way to tie everything together, really. Okay, advice. Advice, one of my favorite parts. You mentioned earlier, stay open, don't say no, say yes, which I thought was
Yes.
great advice. With such a rich and dynamic career path, what advice would you give to pharmacists or pharmacy students who are eager to make a difference in a non-traditional, actually both traditional and non-traditional pharmacy roles? What advice would you give them?
So I always tell everyone that asks me what advice do you have for me. I said always leverage every resource that is available to you, inside and outside the pharmacy field, and embrace the opportunities as they come. In my case, saying no, it's not acceptable. Jump into challenges, and that's the one of the most important. If you don't know how to do it, find it in your inside of you to say, I don't know how to do it, but you know what? I'm gonna go back and study. I'm gonna go
Yes.
back and research,
Yes.
and I'm gonna do it because I want to learn. It's not because I just want to be show that I know, but I also because I want to learn and I want to get better at something that I discover I don't know. And that's actually keeps my mind sharp, and it keeps me curious, and it keeps me engaged.
Yeah.
And that is actually what I would tell to everyone. That is my best advice. Always find things that are challenging in order for you to continue growing.
Yes. So what I'm hearing is stay open to opportunities,
Yes.
build a strong network. Your network was so strong to have someone outside of pharmacy, right?
Yes.
You a lot of recommendations for the job that you currently hold.
Yes.
That is a true testament of building a strong network and embracing opportunities. Sometimes I say yes to a project and I don't know where it's going to take me. But as I'm working on the project, I notice that, oh, I'm actually learning something myself, but I don't even know where it's going to take me. But I trust that someday it's gonna be the opportunity that prepares me for another opportunity.
Yes.
That's fantastic advice. And I'm sure that our listeners will find it incredibly valuable as well as they navigate their own career. Okay, we're coming close to an end, and I want to know what's next for Dr. Fatima Hernandez. Looking ahead as you reflect on your journey so far, what are you most proud of? And looking ahead, where do you see your career heading?
So I actually take great pride when I hear the students share that they know me with all of my classmates.
They all know you. Everybody at Touro knows you. It's amazing.
Yeah, that's actually one of the things that I was not aware until my classmates started reaching out and they said, you know, that I have one of your students that went to your clinic. So, oh, nice. It's
Yeah.
like the first thing that I ask, like, do they know something?
Yeah.
And they always say, yeah, they make you proud.
And
And
one reason I reached out to you too is I was talking to Sarah.
oh, Sarah.
Sarah, and we were working on an interview for Hispanic Heritage Month. And she's like, forget me, you should interview Fatima. She has the most amazing story. I told her, I'll interview you now, but then I'll do Fatima next. So after her, I
Um,
reached out to you.
yeah, Sarah, she's
But
great.
sorry I interrupted you. So you were going over what's ahead.
No, so and also I'm very proud of my willingness to embrace change. And
I am
and
proud of
confront,
it.
yeah, and just confront complex problems and in general. And despite that, I actually started with a very limited knowledge of ICU drips and critical care management. I became increasingly involved in this area now. And
Mhm.
and I know that's gonna be my exciting new opportunity that it's in the horizon for me.
Oh,
Probably I want to actually try to see if I could learn more about ICU and probably put my step into the ICU world as well.
woo, that's a tough world.
Yes, but
That
like I said, challenge.
you really, really love challenge. That's amazing. That's amazing. So maybe, are you thinking like critical care pharmacist kind of certification?
Probably yes. Like I
Okay.
said, we don't know where life's gonna take us. And in my case, I don't like to feel like I'm like stuck. I don't like to feel, just in one
You want to
place.
keep growing.
I wanna keep, yeah,
Yeah.
exactly.
If
And
you're not growing, you're dying. That's what I heard
exactly.
someone say one time. Yeah. So,
Yeah, and
yeah.
like in part of the growing is also to learn more skills that we did not have during our curriculum as
Mhm.
a pharmacist,
Mhm.
and learning new things. That's one of it's my I say it's my hobby,
It's your hobby?
because yeah, because I always like to learn new things.
Yeah. Okay.
It's
Yeah.
the way that I feel that even though I remember having the other day a neostigmine drip. I never done one, and this critical care doctor came to us and they asked us, "Hey, I want you guys to make it for us." And I'm like, "What do you mean make it?" It's like, "Yeah, it hasn't been made in the hospital. You were going
The
to be
patient needs it is the bottom
needs
line.
it. It's
Mhm.
the bottom line. They need it." And like in my case, I was like gonna say I cannot do it
Yeah,
because
you have to
I've never
figure out.
done that.
Yeah. Yeah.
And
Yeah.
like we figured it out, and I was actually part of the first ever built module in creating a drip that it has never been used in the hospital.
Oh my God.
So, so that's
Amazing.
why I'm telling you, it's amazing. And when you open
Yeah.
yourself to, like I say, problems always look for me, and I'm always happy to to start like a solution.
Yeah. Yeah.
And that's what happened. I feel very proud of it that day because I actually asked the one of the pharmacies that they are critical care pharmacies. It's like, how come you always get these weird and harder orders, medical orders from a provider? And I'm like, I don't know.
Always find me. I'm a
Yeah, the
problem
problem is
magnet, but
finding.
also a solution finder. This is so cool. It's clear
Yeah.
that you're making an impact everywhere you go by putting in the work, embracing challenges, as long as it makes a meaningful impact for the patient, you're down. So,
Yes,
Fatima,
definitely.
Thank you so much for sharing your incredible journey with us today. Your story is it's a powerful reminder of the impact pharmacists can have in so many different ways, from the bedside to the community to the school, to the
Yes.
academic setting, to the future healthcare providers. So I want to say thank you again for joining us and sharing your story.
No, thank you so much for having me. I'm very honored to be
It's
here,
been
finally sit with you and have this conversation.
the honor. It's mine. It's been a pleasure to share your story, and I hope it inspires others to explore the many opportunities that pharmacists have to offer.
Yes, definitely.
Thus, pharmacists do more than count pills. And to our listeners, thank you so much for tuning in to the Rookie Pharmacist podcast. Don't forget to subscribe for more inspiring stories like Fatima's and just practical tips to help you thrive in your pharmacy career. And until next time, take care and keep making a difference. Stay blessed. Bye bye.